Well, personalization was a lot of what this ASH was about, actually trying to think about. Now we've got quite a lot of choice of therapies. How do we decide which therapy for which person? How do we decide when it's not working anymore? Are there some patients where we should treat much earlier? And so we don't have all the answers, but this was very much something that we were talking about a lot at ASH. And thinking about the data that we presented, for example, about young patients, we might want to intervene earlier with a treatment for young patients and even use a more aggressive treatment to try to achieve a remission so that they can, for example, undertake pregnancy, etc. So not quite there yet, but one example where we did actually explore this in quite a lot of detail, and we continue to do so, is as we have 3 or 4 JAK inhibitors available for myelofibrosis, it's actually thinking about which of those JAK inhibitors would suit which patient. So for colleagues in North America, they're really lucky. They have pacritinib, which is suitable for patients with platelets less than 50. In the UK, we have momelotinib, which is approved for anemia or spleen or symptoms, and can be used for patients with platelets of 25 and above. And then we have fedratinib as a second approved JAK inhibitor, mainly now available in the UK anyway as a second, third line setting, but elsewhere as a first or second line setting. And then, of course, our kind of go-to oldie favourite, ruxolitinib. So thinking about which patient should have which drug, when, and how would we define success is really helpful. I think as we go forward, we're looking to adding things to those agents. And we did see some, really exciting preliminary data from ASH regarding the Boreas study with navtemadlin. Look out for an interview, I suspect, with John Mascarenhas about that. But that could be a really exciting agent. And there's a trial in progress, the Poesis study. And then the other agent that we're looking at, to comprehensively add is selinexor. What we saw at ASH was some real-world data from China regarding that agent, but there's an open study on the portfolio to consider. And then there are other agents as well, like elritercept, that we presented data for. So we're getting there.